Clonazepam, Klonopin, uses, benefits, side effects, and safety tips. Clonazepam is a potent medication from the benzodiazepine family, prescribed to manage a variety of neurological and psychiatric conditions. It is commonly used to prevent and control seizures and to treat panic attacks by exerting a calming effect on the brain. Its primary benefit is its effectiveness in reducing abnormal electrical activity in the brain, which helps control seizures and alleviate severe anxiety. What is clonazepam? Clonazepam, also known as Klonopin, is a drug that is used to prevent and treat epilepsy, panic attacks, and the movement disorder akathisia. It belongs to the benzodiazepine class of tranquilizers. It is taken orally. The effects start after 1 hour and last for 6 to 12 hours. What are the benefits and uses of clonazepam? Clonazepam uses include treating and preventing seizures, and helping individuals experiencing panic attacks by calming the brain and nerves. It is classified as an anticonvulsant or antiepileptic drug. Conditions clonazepam treats. Clonazepam is FDA approved for seizure disorders, effective against various types of seizures, including acute management of epilepsy, non-convulsive status epilepticus, and minor motor seizures of childhood, e.g., petit mal absences, Lennox-Gastaut syndrome. It is also useful for psychomotor, myoclonic epilepsies, grand mal, and focal motor seizures, especially in resistant cases. Panic disorder treats panic attacks in adults, alleviating severe anxiety and associated symptoms. Secondary uses of clonazepam. Beyond its approved uses, clonazepam is also utilized off-label or as an adjunctive therapy for akathisia, mania, restless leg syndrome, insomnia. Burning mouth syndrome may be more effective than diazepam in some studies. How does clonazepam work? The mechanism of action of clonazepam involves enhancing the effects of a natural chemical in the brain called GABA. This action helps to slow down nerve signals, resulting in a calming effect. Clonazepam works by increasing the activity of gamma-aminobutyric acid, GABA, a neurotransmitter that inhibits brain activity. By making the brain less excitable, it reduces the severity and frequency of seizures and alleviates feelings of panic and anxiety. Clonazepam dosage. Proper clonazepam dosage is crucial and highly individualized based on the medical condition, patient age, and treatment response. Take clonazepam orally, usually 2 or 3 times per day, as directed by your doctor. Dosage for children is often determined by weight. Typical dosage instructions. For seizures, adults and children, 10 plus years, initial 0.5 mg 3 times daily, maximum usually 20 mg per day. Children, up to 10 years or 30 kilograms, 0.01 to 0.03 mg per kilogram of body weight per day, in 2 or 3 divided doses, maximum usually 0.05 mg per kilogram per day. For panic disorder, adults, initial 0.25 mg 2 times daily, maximum usually 4 mg per day. For restless leg syndrome, usual dose 500 micrograms to 2 mg daily. Special populations, lower doses may be recommended for individuals over 65, or those with kidney, liver, or severe breathing problems. Specific instructions for clonazepam tablet and clonazepam mouth dissolving forms. Clonazepam tablet, swallow whole with water, with or without food. Clonazepam mouth dissolving, orally disintegrating tablet/wafer, handle with dry hands. Peel back foil to remove, do not push through. Place in mouth to melt quickly. What should I do if I miss a dose? If you miss a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and continue with your regular schedule. Never double the dose to catch up. What happens if I overdose? An overdose can be dangerous and requires immediate medical attention. Call a poison control center right away if you suspect an overdose. Symptoms of overdose: severe drowsiness, confusion, loss of coordination, and difficulty breathing. What to avoid: do not stop taking clonazepam abruptly without consulting your doctor. as this can cause withdrawal symptoms. What are the side effects of clonazepam? Like any medication, clonazepam can cause side effects, which can range from mild to severe. It is important to be aware of the potential clonazepam side effects and report any concerns to your doctor. Common side effects: drowsiness and sedation, dizziness, loss of coordination or unsteadiness, fatigue, memory impairment, increased salivation. Serious but rare side effects: worsening of seizures, abdominal pain, depression or suicidal thoughts, confusion or difficulty speaking, allergic reactions. Advise users to consult a doctor if any symptoms worsen or become bothersome. Precautions and warnings. Certain individuals should use this medication with caution or avoid it altogether. Always discuss your full medical history with your doctor before starting treatment. Who should avoid this medicine? Individuals with a known allergy to benzodiazepines. People with severe liver disease or narrow-angle glaucoma. Conditions where caution is needed. Caution is advised for patients with kidney disease or lung/breathing issues. Neurological conditions like myasthenia gravis or Parkinson's disease. History of seizures, due to potential for paradoxical worsening. Mental health conditions, bipolar disorder, depression, psychosis, suicidal thoughts/actions. History of alcohol or drug abuse/substance use disorder. Are there any age restrictions for using clonazepam? Older adults, 65 plus, may experience heightened effects like drowsiness and confusion, increasing fall risk. Lower doses are generally recommended. Pregnancy, use only if absolutely necessary due to potential harm to the unborn child. Breastfeeding, can pass into breast milk and may adversely affect nursing infants. Consult a doctor. Children, doses are weight and age dependent and must be carefully managed by a doctor. Alcohol or food interactions. Alcohol, avoid, significantly increases dizziness, drowsiness, and risk of severe, life-threatening breathing problems or coma. Grapefruit, discuss consumption with your doctor. Possible interactions with other medications, drug interactions. Clonazepam can interact with other drugs, which may alter its effectiveness or increase the risk of side effects. Always inform your doctor of all medications you are taking. This medicine may interact with other drugs that cause drowsiness, including opioids, antihistamines, and other sedatives. Medications like orlistat and sodium oxybate are known to interact with clonazepam. Always consult your doctor or pharmacist before combining clonazepam with supplements or herbal products. How should clonazepam be stored? Proper storage helps maintain the medication's effectiveness and ensures safety. It is important to keep it in a secure place. Recommended storage temperature. Store at room temperature, away from direct light and moisture. Do not store it in the bathroom. What happens if clonazepam is not stored properly? Improper storage, e.g., in a washroom with fluctuating humidity/temperature, can lead to medication degradation, reducing effectiveness or rendering it unsafe. Keep away from children, sunlight, or moisture. Crucially, keep all drugs, including clonazepam, out of sight and reach of children and pets. Store in a safe place to protect from theft due to its abuse potential. Accidental overdose and death can occur if taken by others. Do not use after the expiration date. For disposal, mix unused medication with an undesirable substance, e.g., cat litter, coffee grounds, in a sealed container before discarding. Do not offer this drug to someone else. Regular laboratory and/or medical tests, such as liver function tests, full blood count, should be conducted to track your progress or check for side effects. For more facts, speak to your doctor.